Hey guys, it's Dr. Saxon here. I just finished a lip lift in the office and I thought I would touch on something that came up yesterday in clinic. I do a lot of lip lifts from patients all across the country. So this patient was from California in my virtual clinic and she had a lip lift a month ago with another surgeon. And what she was complaining about, she was very distraught, very worried that her lip was not ever going to look normal again. And that's because the central part of her lip, the philtrum, was still very swollen and firm, and her lip was tethered upward. And so it didn't look like a normal looking lip. And so she was asking me if that would ever go down or if there was anything she needed to do. She sent over her operative report, and after reviewing it, I saw that her surgeon actually used what's called a periosteal stitch. So even though it was a dissolving stitch, it was placed from the lip down to the periosteum, which is the layer that is just outside of the bone. It's a very firm layer, strong layer. A lot of surgeons use that stitch to try to keep tension off the incision and give more longevity to the results. I don't like that technique for a couple of reasons. One is that it can distort the nostrils. So a lot of people ask whether a lip lift distorts the nostrils. Usually a lip lift does not do this unless you use that stitch. That stitch can cause a lot of fibrosis and scarring in the area just under the nose, and that can cause some shifts in the nostril shape. The other reason I don't like that stitch is because to get to the periosteum, you have to go through every single layer of the upper lip. That means the skin, the subcutaneous fat, the muscle, the fat underneath the muscle, and then down to the bone. To do that, you have to disrupt a lot of lymphatic channels. And lymphatics are tiny little vessels that take away all the fluid that circulates in our face all day long. With any surgery, you disrupt lymphatics, but the goal is to disrupt the normal anatomy as little as possible. So when you're going all the way down to the periosteum, inevitably you're disrupting almost every lymphatic channel in the upper lip. And so that is why a periosteal stitch can cause prolonged swelling, even months, despite doing all the right things after surgery. I also don't like a periosteal stitch because it tethers the upper lip upward and prevents the orbicularis muscle from functioning properly. And this may not be forever, but again, if you're swollen for months on end, the orbicularis muscle is also swollen. And so you won't be able to purse your lips or smile or talk quite normally, and it can be very distressing for patients. I've even had some patients come to me that their upper lip looks so distorted with movement that it almost looked like they had a cleft lip and palate at one point. There's a couple things you can do if you've already had a technique like this, which I told the patient yesterday. I can go in and make that incision again and cut those deeper sutures that are still there. What this does is relax all the soft tissue, and in the short term, this can prevent some of the scarring, but if it's more long term, I can go back in and clip all that scar tissue to just try to get some more length and movement to the upper lip. But just going in and clipping those sutures can help relax all the tissue enough to where we can start to try to heal a little bit more normally. What I do to prevent a wide scar with a lip lift, which can be difficult because the mouth moves a lot. So we are smiling, we're talking, we're pursing our lips, and all those things can potentially widen a scar. Don't usually see wide scars in people over 50. When you're older, you just heal a little bit better. You don't produce as much collagen in response to the healing. But if you're younger, you may be predisposed to a wider scar or a thickened scar. I found my sweet spot in that I still put deep sutures in, but they're not as deep as the periosteum. I use sutures that are just on the fascial layer, just outside the orbicularis muscle. You don't have a SMAS, a supramuscular aponeurotic system, like the lateral face. That's what we use to lift the face in a facelift. You don't have that layer in the mouth, but you do have a pretty strong fascial layer just outside the orbicularis muscle. So I don't put my deep sutures in the subcutaneous fat. I actually put them in that fascial layer and secure them to fascia just at the base of the nose, but not going deep. I use PDS sutures still that stay in about 3 months. And what that does is it takes tension off enough while still maintaining normal movement of the mouth. Since those sutures are taking tension off in those first 3 months, by the time they dissolve, that scar tissue has strengthened enough to where it can withstand the forces of you moving your mouth. I also do something else at the time of my procedures. I do a blood draw and we spin it down in a centrifuge and make something called PRF, or platelet-rich fibrin. And PRF has growth factors in it, and so it helps to mature all the scar tissue a lot faster. And I feel that it also decreases inflammation and helps the scar heal a lot better. After surgery, I have you use a hypochlorous acid spray that also reduces inflammation, and I don't like any ointments because I find that it attracts bacteria and traps it in there. And so I have a lot more redness if I have patients that use ointment versus not. And so those are a few of the tricks of the trade for me. But certainly I don't like to use those anchoring sutures to the periosteum because I've just seen so many patients with so many problems from them. I like everything I do to look as natural as possible, and I just feel like periosteal sutures do not lend themselves to a natural result. So if you have any other questions about lip lifts, I'm happy to see you for a virtual consultation or in-person consultation. I'm in Austin, Texas, and I also have an office in Dallas. If you're interested in a lip lift or just think you might be interested, give us a call or leave a comment below. I'd be happy to answer any questions you have.